So what's happened? What's been the change in the landscape? Well, there have been a number of laws that now have been adopted nationwide. Criminal per se laws, those are laws that make it a criminal offense per se to drive above the legal blood alcohol limit. Administrative license revocation, those are laws where the police can seize at the scene the license of a driver who either refused a breath test or who failed a breath test. Actually, a stronger deterrent than the criminal per se because it's swift and certain. Sometimes in criminal cases they go to court and they don't go to court for many months, and oftentimes the person doesn't get convicted if the jury, here, but for the grace of God go I, if they get that sort of thinking in their head. Mandatory assessment and treatment laws as a condition of having licenses reinstated. Primary safety belt laws. That's pretty interesting. Why would I put a safety belt law down as one that reduces drinking and driving? Anybody have any idea? In California, they went from a secondary law where the police had to stop the driver because there was some visible traffic violation, like speeding or weaving or whatever, to a primary law where the vehicle can be stopped simply if the police see that somebody's not wearing a belt. It increased belt use by about 20% on average, but we were doing roadside surveys out there, one of our researchers, and they found that young drivers and drivers who were driving after drinking actually increased belt use by 40%. Now, why would the drinking drivers increase the belt use by 40% as a result of a safety belt law? They don't want to get stopped and then have that whole cascade of drinking and driving penalties come down on their head. So it has a disproportionately benefit in reducing drinking and driving. Ignition interlocks for first-time offenders. Half the states now have laws where Massachusetts doesn't yet. We do it only for repeat offenders. Lowering legal blood alcohol limits for convicted offenders and lowering down to 0.08 for all drivers, and zero tolerance laws making it illegal to drive after any drinking if you're under the age of 21. There's also environmental policy interventions such as raising the minimum drinking age, which I'll talk about in a little more detail in a minute, reducing alcohol outlet density, and increasing the price of alcohol. Young people in particular have less discretionary income and are very sensitive to price increases, but there's a huge literature on this, and increasing the price of alcohol even affects people who are alcohol dependent. Not as much as the general population, but even that subgroup gets affected. So let me talk first a little bit about the legal drinking age of 21, which is now the legal drinking age in every state in the United States. Have any of you ever heard of the Amethyst Initiative? Yeah. This was an initiative that a former Middlebury College president named John McCardle initiated with the idea of lowering the drinking age to 18 and having education for people under 21 about alcohol and giving people drinking licenses. And if they drank to excess, then their drinking license would be taken away from them. No evidence that there was any value in that type of proposal, but he persuaded 135 of the 3,500 college presidents in the United States to sign a petition saying that that was a good idea to pursue. One of the arguments that they had was that the legal drinking age of 21 drives drinking underground into unsupervised circumstances, and that leads to explosive drinking. Well, we looked at it in our national survey, and what we found was that actually, if you compare people aged 21 to 24 to those 18 to 20, the ones who are 21 to 24 who can drink legally are actually the ones that are more likely to engage in 10 or more drinks at a time, or 21 or more drinks. That's the equivalent of a fifth of liquor at one time. That's an extraordinarily dangerous amount of alcohol to be consuming at one sitting. And college students, in particular, were the ones that were most likely to engage in this heavy, explosive drinking. Now, some people say, if only we could teach our kids to drink in a civilized fashion like they do over in Europe, where they have a lower drinking age, then we'd be a lot better off. Well, there have been studies. There's a study called the SPHHS study that did surveys of 15-year-olds in 35 different European countries and compared the results to the monitoring the future surveys here in the United States of 15 and 16-year-olds. Here's the United States over here, and this slide is of the proportion of 15 and 16-year-olds who drank to intoxication in the past year. And then these are the other European countries. And unless I'm misreading this figure. It looks to me like in all but maybe 3 or 4 European countries, there's a higher percentage of 15 and 16-year-olds who drink to intoxication than 15 and 16-year-olds here in the United States. So the notion that the European youth drink in a more civilized fashion is a myth. It's just simply not true. In fact, Jürgen Rimm published a very interesting article in Lancet back in 2009 where he compared different regions of the world. And it turns out that Europe has the highest per capita alcohol consumption. It has the highest percentage of deaths that are attributable to alcohol misuse, the highest alcohol attributable burden of disease measured in DALYs, or disability-adjusted life years, and the highest past year prevalence of alcohol use disorders, more than twice or nearly twice what it is worldwide. So the notion that the Europeans have gotten this figured out it's just not true. Now, they do have lower legal blood alcohol limits than we do, and they have a higher age of driving licensure, so maybe we could learn from them on those accounts. And many of them have better public transportation than we do. But I think in terms of the legal drinking age, maybe they could draw some lessons from the United States. Let's take a look at the data of the impact of the law. These are the Monitoring the Future studies. Back in 1984, there were only 17 states that had a drinking age of 21. That's when Congress passed and President Reagan, the ultimate states' rights president, signed legislation saying that if states didn't raise the drinking age to 21, they were going to lose federal highway construction funds. And when he signed the bill, he said, you know, I'm a strong believer in states' rights, but sometimes saving young lives is more important than states' rights, and so that's why he signed the bill. And by 1988, all 50 states had raised the drinking age to 21. We can see the proportion of high school seniors that engaged in binge drinking, who were drinking to intoxication, was essentially cut in half over that time period. If we look at people who are college age but not in college, there was also a decline, not quite as steep. And even among full-time college students, there was some decline in binge drinking. If we look at the alcohol-related traffic deaths, there's no age group that had a higher reduction in alcohol-related traffic deaths than the 16 to 20-year-old age group, down 77% over that time period. Whereas the non-alcohol related deaths only went down about 25% during the same period. There have been a number of literature reviews on this. CDC, in their community guide program, reviewed 49 studies that found when the drinking ages were lowered, the alcohol-related traffic deaths went up, and then vice versa when the drinking age was raised, the traffic deaths, alcohol-related traffic deaths in the 18 to 20-year-old age group went down 16%. Jim Fell, one of our investigators that we fund, has done, I think, the most comprehensive study of this, where he looked at over 20 years of data from the Fatality Analysis Reporting System, looked at a whole host, controlled for a whole host of potential confounding variables, and found that the raising the drinking age to 21 reduced the proportion of fatal crashes that involved alcohol in the 18 to 20 age group by, again, he replicated the CDC findings by 16%. He also found something that I thought was quite interesting, and that was that when he looked at some laws that target not just teens, but target adult drivers, such as lowering the legal blood alcohol limit or administrative license revocation and safety belt laws, that those also further reduced alcohol-related traffic deaths in the 18 to 20-year-old age group, each by another 5%. So that's a very interesting finding. What it means is that if you point at young people and say, you're the problem, you're the alcohol problem that we have in our society, and don't own up to the fact that all of us can be part of the problem, and there ought to be laws that curb all of our, or restrict all of our behaviors to be more responsible, then young people, if they don't see adults taking responsibility, they'll feel that adults maybe are being a little bit hypocritical. But if we have laws that affect all of us, then I think they'll be more likely to affect them.